Hey everybody, how's it going, Facebook? Sorry about the delay in getting started today, and sorry about being absent for the last 2 months. 2 months, 2 weeks. Feels like it's been 2 months. A lot going on right now in the world. A lot going on in this year, 2021. Happy New Year, everybody. I hope everyone had happy holidays. Basically, it's 2020 is a wrap, and 2021 has started with a bang. But you know, the name of the game for this year, from my standpoint, is this is going to be the year for us to take back control of our lives. And part of that really is going to be to help us take control of our bodies. So just so you know, we are here for you, and even with everything going on in California, with our lockdowns and everything like that, our clinic is open for you. We are doing a lot of telemedicine, but we are also seeing patients in person. So if you have any questions, if you have pain, if you're worried about something going on, an injury or whatnot, you don't have to suffer in silence, and there are things that you can do without exposing yourself to increased risk. So please reach out if you have any questions or concerns. So that said, today we're going to be talking a little bit about the knee, and specifically the ACL in the knee. I've had some patients come to me recently talking about, I had one patient say that they had an ACL surgery years ago. They ended up having a re-tear of their ACL, and they wished that they knew about some of the other options that were out there at the time or currently. I had another patient this week talk about how they had an ACL tear, but they actually opted to do nothing about it, and they actually did fairly well overall. So today I want to really focus on what is the ACL, why is it important, what options are there for treatment, and when is it or is it not necessary to have surgery. So first and foremost, what is the ACL? So I'm going to try something new a little bit today. I have a new toy, and instead of using a model, I'm going to try to use, I don't know if this is going to work here. I'm going to try to use this to really show what's going on inside the knee. So this is a knee right here, all right? This is kind of what the knee looks like without any of the things stripped away. Here is the knee with the knee cap stripped away here. And what we're looking at is at the top there's the thigh bone, and there we go, the thigh bone over here and the lower leg bone over here. And in between is where we see this line going down. That is actually the ACL. I'll highlight it over here for us. That's the ACL right there. So the ACL is this little, or seemingly little, ligament that's deep inside the knee. It's actually a pretty robust ligament that is really important in stabilizing the knee joint. So what do I mean by that? First of all, what is a ligament? A ligament is a soft tissue structure that connects bone to bone. Some people describe ligaments as duct tape connecting bone to bone, kind of supportive. The way I describe this, and some of my patients have heard me say this, is that ligaments are like those really thick rubber bands that surround broccoli in the grocery store, right? They're strong, they're supportive, but there's some elasticity to them. They're not like super loose like a normal rubber band, but there is some elasticity to them, and that's what the ACL is like. That's what all ligaments are like throughout the body. Now the ACL is unique. There's actually two bundles of the ACL that kind of crisscross, and the ACL in the direction that it goes is really involved with preventing the knee from twisting excessively, and also stabilizes the knee when the knee goes from side to side. Now the ACL, most typically when you think about ACL injuries, you think about football players, you think about impacts injuries where your knee gets hit and then you have an ACL tear. But in actuality, that's not the only way an ACL tear can occur. It's actually very common for you to have an ACL sprain or tear if you're mechanically not moving properly. And it's actually very commonly seen in jumping athletes and in various other sports and in daily life, if particularly our knee actually buckles inwards. So if this is the knee that we're talking about, if it buckles inwards like this, then that can actually cause a sudden stress on the ACL, causing a tear. So if you're ever watching basketball and you see someone get the ball, catch it, and then their knee kind of buckle inwards, nobody else is around them, and then suddenly they drop to the floor, well, that's an ACL tear unless proven otherwise. So what flavors do ACL tears come in? ACL can be sprained or basically be pulled and have little micro tears in it. An ACL can get a partial tear, meaning that a part of the ligament is torn, but not the full thickness is torn through. Or an ACL can have a full thickness tear, meaning that the ligament is cut straight through. Now, we can actually differentiate that a little bit further as well. Because if that ACL is partially torn, remember I said that the ACL actually has two bundles that crisscross. So either one of those bundles can have a partial thickness tear, or both can have a partial thickness tear. Similarly, if there's a full thickness tear, you could have a full thickness tear of one of the bundles and not the other. Or you could have a full thickness tear throughout. And then even within the full thickness tears, there are those that are torn through, but the fibers are still lined up. Or there are situations where the fibers are torn through and they're flapping in the wind. One fiber is pointing this way and the other fiber is pointing this way. They're completely disjointed, or what we call is retracted or pulled back. So there's a few different flavors of ACL tears that can occur with various injuries. Now, can ACL tears occur without injuries? Well, the answer is actually yes. Over time, if our mechanics are not correct, particularly if we have some weakness on the outside of our butt, and with every step that we take, instead of us moving straight, our knees actually bending inwards or getting knock-kneed with every step that we take, then that can gradually put some stress on the ACL over time, and over time that can gradually get stretched, irritated, micro tears, and then even major tears from that. You could have tears that are associated with arthritis. You could have tears that are associated with other conditions that are going on inside the knee. And especially with trauma, you can have conditions like meniscus tears. You can have conditions like injuries to other ligaments within the knee. And ultimately, there could be a lot of animals in the zoo. So when we have these various different types of ACL injuries, what options do we have? Well, the real question is, how is the ACL injury affecting us? And what are our goals in terms of recovery? And this is kind of a thick subject, and ultimately we're going to have to delve into this more in depth on a different date, so you're going to have to stay tuned. But really we need to stratify what symptoms are we having, how is it affecting our function, what do we need to get back to, and what are our goals in life. So for example, if you're having a significant amount of pain in the knee, but you're not necessarily having instability, like your knee's going to buckle, the pain actually may not be related to the ACL. ACL tears are notorious for causing instability or buckling, like the knee's going to give out from underneath you, or your knee's jiggling with steps that you're taking, things along those lines. When you have an acute ACL tear, there's swelling that can occur inside the knee joint, but pain is actually notably absent in a lot of situations. So when you have pain associated with an ACL tear, it's oftentimes other things that are involved as a part of the picture, whether it's a meniscus tear, a tear of another ligament, or the kneecap not gliding properly, the arthritis or inflammation inside the knee. There's various other things that can actually be causing the pain associated with an ACL tear. So if you're not having any significant instability, then we may not even necessarily have to treat the ACL. If you are having substantial instability, if you're having some looseness with the ACL, then the question is, how is that affecting your function? Because if you are a young professional athlete or a young aspiring athlete or someone that is using their knees as a part of their daily livelihood, and you have a significant amount of instability that's preventing you from doing the things that you need to do, well, that's a situation that we may actually want to consider surgery. Okay? But if we're not necessarily using our knees for our livelihood, or even if we are, but we fall under certain parameters, there are things that we can do to try to prevent surgery. So there's some interesting studies that came out a few years ago that I need to kind of mention here. There was a study that came out in the New England Journal of Medicine a few years ago that actually looked at patients that had it was a randomized controlled trial that looked at patients that had surgery early, immediately following their ACL injury, versus those that had physical therapy first before opting in or out of surgery. It was really fascinating was that those that had the early surgery did not offer any significant advantage compared to those that first tried physical therapy first. So waiting to have the surgery didn't necessarily negatively impact the outcomes from the surgery itself. And what was even more interesting was that 61% of those people that had the physical therapy first actually ended up having enough improvement that they opted not to have the surgery altogether. This is a really important statement because if we have an ACL tear, even if we do have instability, but we don't necessarily need the knee immediately for our livelihood, then we could try things like physical therapy conservatively and get the knee functioning appropriately and try to avoid surgery altogether. It's an important statement because surgery itself has potential side effects associated with it, but putting those side effects aside, because that is a small population, putting those side effects aside, the recovery from an ACL surgery is actually pretty profound. There are studies that look at athletes and returning to play. There was one study that looked at soccer players that 2 years after an ACL repair surgery were still not at their pre-injury status in terms of their athleticism. So the recovery from an ACL surgery can be pretty profound, and if we go back to sport or back to a high level of activity too early after an ACL surgery, we run the risk of re-tear. So it's really important to think that, if we can manage an ACL tear conservatively, why not try that first if waiting to have the surgery doesn't necessarily negatively impact the outcomes. And then the other important thing to realize now is that in certain parameters, for partial thickness ACL tears, for ACL sprains, as well as for certain full thickness ACL tears where the ACL is not flapping in the wind, right? It's not completely retracted. In those circumstances, we're actually able to heal the ACL or even regrow some full thickness ACL tears using a patient's own bone marrow stem cells. So that's an important statement because if physical therapy alone is able to avoid a surgery for 61% of patients, then if we can augment that with a biologic treatment, then maybe, just maybe, we can return the function of the ACL at a better consistency, at a higher rate, and actually improve the healing of someone's native ACL itself. So really, ultimately, we need to look at what situation are we in, what symptoms are we having, what are our goals, right? What's our age? If we're young and we're an aspiring athlete, or we have significant instability, then maybe an ACL tear repair surgery is actually the right way to go. Um, but even in those circumstances, are there situations where we can actually prevent surgery, get you back to sports sooner, heal that ACL? And especially outside of those circumstances, if you're older, if you're not a professional athlete, if you have an ACL tear, can we provide you benefit and can we get you back to living your life while trying to keep that joint as native and healthy as possible? So a lot of options to consider, a lot of details, and this is something that's important because we don't want to automatically say, okay, this is what I saw on my MRI and it needs to get fixed, because the fix may sometimes be worse than not fixing it. And we have to understand that there are a lot of different options that are out there. So to summarize, an ACL tear is not an ACL tear is not an ACL tear. And there's more solutions than surgery for ACL tears. Sometimes surgery is absolutely necessary, but physical therapy, exercise, bracing, injection treatments, particularly focused image-guided injections directly into both bundles of the ACL using a patient's own bone marrow can actually be really, really beneficial for healing ACLs. There's a lot of options out there, and if you do have an ACL injury or know somebody that does, feel free to hit me up. We can go through what those options are, because if you do fall outside of parameters for conservative management and you do need surgery, that's something that's definitely a good idea to do. But if we can avoid it, we should avoid it. What I'll do is I'll post or repost some of the before and after images that we have of some of the patients that I've treated using their own bone marrow stem cells to actually heal their ACL. I'll post those on my social media across all platforms. I'll include some of those in the comments for today. But basically, if you found this helpful at all, if you found this interesting at all, please like, share, comment. If you like what you're hearing, I can delve further in on this topic. We can talk about surgery. We can talk about non-surgical options. We can talk about the stem cell treatment. Or if you have other things that you want to talk about, hit me up, send me a comment, DM, or you can email us at info@fxregencenter.com. Hope this was helpful for you guys, informative. If you have any questions, hit me up. And otherwise, have a great day. I will see you next week.